Today on Investigate TV Plus, it's one of the most preventable and curable forms of cancer in women, but social and economic barriers prevent some from getting checked.
Women really want a better way, and 1 in 4 women right now are behind on their screening.
We take an in-depth look at solutions to improve access to cervical cancer screening, including an at-home option for early detection. Plus,
all of this can be prevented, and you can still survive. I'm a survivor.
A cancer survivor encourages more women to take control of their health.
Then,
everyone always thinks like, oh, my grandmother had it, or my grandfather had it, my great-grandma had it.
but it's not just your grandparents' health concern anymore. We provide insight into why strokes are becoming more common in men and women under the age of 45 and how you can reduce your risk.
And a dog's day.
There's just this unconditional love and warmth that dogs provide you.
A trio of pups inspires pets, pats, and purpose.
In-depth stories that inform and inspire. You're watching Investigate TV Plus. Groundbreaking, even game-changing. That's what some experts and advocates say about 2 new tools in the fight against cervical cancer. I'm Lee Zurich.
And I'm Tisha Powell. These latest developments aim to expand access to life-saving screening because cervical cancer can be treatable and survivable with early detection. The problem is not everyone is getting screened, which traditionally involves a pelvic exam in a doctor's office.
According to the CDC, about half of women who get cervical cancer weren't screened as recommended before their diagnosis. And an American Cancer Society study published in 2025 shows cervical cancer screening rates are down 14% since 2019, a decline that started during the COVID pandemic and has yet to rebound.
Reporter Heather Graff explains the existing barriers and recent FDA approvals that put the power of prevention into a woman's own hands.
This was the day I found out I had cancer.
When Toni Cooper Towler snapped this selfie back in October 2017,
I was at work.
she had no idea a life-altering phone call would come just a few hours later.
So I answered, and she said, Ms. Cooper, I regret to inform you that we have detected you have cervical cancer, stage 2.
Toni's mind went instantly to her 3 young children.
I was really scared because it was just me, and I had 3 people depending on me.
But today, she shares her story as a proud survivor of cervical cancer, a disease that claims the lives of more than 4,000 U.S. women every single year.
Everyone needs to know about it. Everyone needs to know the damage it can do, but also everyone needs to know you could minimize the damage if you just get yourself checked.
Toni says her cancer was caught early during a routine pap smear. And as a patient turned advocate, she now knows that's one of 2 proven screening methods. Experts say the other is an HPV test to detect the human papillomavirus that causes almost all cases of cervical cancer. Both tests are done in a doctor's office using a speculum to scrape cells from the cervix. And while the procedures can be uncomfortable for some women, they're considered highly effective.
Are cervical cancer deaths preventable?
Almost entirely. We never speak in absolute terms, but sure, the vast majority are preventable.
But not everyone is getting screened.
Right.
Why is that?
The first thing would be socioeconomic. You have to look at people maybe they don't have insurance, perhaps they just don't have access to health care. Another thing can be something as simple as, can you get time away from work? What about transportation if your clinic is not nearby? And shame and stigma. Cervical cancer screening for a lot of patients, understandably, can be awkward, can be off-putting.
Fred Wyand is with the National Cervical Cancer Coalition and says the hope is newly approved screening options could help remove some of those barriers for patients.
There's sort of a trend in public health about really trying to meet people where they are. This is just part of that evolution.
In May of 2024, the FDA gave the green light to what's known as self-collection HPV tests for use in a healthcare setting. That means you'd still go to the doctor's office, but a pelvic exam would no longer be required. Instead, patients can choose to use one of these kits containing a small swab or brush to collect their own vaginal sample in a private room. After that, it's sent to a lab for HPV testing. And if it comes back positive, there would be a follow-up appointment to talk next steps with the doctor.
How significant is this development, would you say?
I think this is a very significant, very major development. And I do want to reassure people that multiple countries around the world have actually been using this for a number of years.
Dr. Kathy McLaughlin is a Mayo Clinic family physician who specializes in cervical cancer prevention.
It looks like this.
And showed us the self-collection test she began offering to patients in clinic as of February 2025.
Essentially, it is kind of like inserting a junior tampon or a very narrow tampon to collect this sample.
Less invasive, she believes, than traditional screening methods.
I'm thrilled that we've had almost 100 people do this in just 2 months. And these are really people that I truly believe would otherwise not have been screened.
Meanwhile, the U.S. Preventive Services Task Force has moved to endorse self-collection for cervical cancer screening, writing in its draft recommendation that studies show this option is just as accurate as when the HPV sample is collected by a clinician.
We can save lives.
Professor Jennifer Smith of the University of North Carolina at Chapel Hill has spent years looking at not just the accuracy of self-collection, but also women's willingness to try it. In one study, her team mailed at-home HPV self-collection kits to hundreds of patients who were overdue for screening.
And overwhelmingly, women returned the kit back, and we found that they found the process of self-collection and mailing highly acceptable, which was really, really very important.
That's why she was supportive, but perhaps not surprised, when in May of 2025, the FDA signed off on the first ever at-home alternative to the Pap smear. Similar to those previously approved for self-collection in a healthcare setting, except this test has been cleared for virtual prescriptions and can be mailed directly to a patient's house.
Self-collection is obviously a way that we can increase access.
It's a message that resonates with Toni Cooper Towler ever since she endured a hysterectomy and was eventually declared cancer-free.
You can survive. You can survive.
So when she learned self-collection cervical cancer screening is now a reality in the doctor's office and also at home,
that is amazing.
This survivor called it a groundbreaking advancement in preventive health care.
With the technology that we have now, you don't have to miss a beat. You really don't have to.
A company called Teal Health developed the device that secured that first ever FDA approval for at-home cervical cancer screening. They call it the Teal Wand.
So it's actually the length of a tampon. And the way it works is, you just insert it. It's designed for all bodies, so you really just go as far as comfortable for you. And then it's a soft sponge that you rotate 10 times and you collect the sample.
That's Kara Egan, the CEO of Teal Health, showing us the device, which she says will first be available in California, though the company is working to expand to other states. Egan told us the goal is to eventually get to the point where any doctor can prescribe this at-home test and insurance will cover it. It's also worth noting self-collection is already an option for other routine screenings in the U.S., such as colorectal cancer. Still, one thing we heard from everyone we spoke to is that self-collection for cervical cancer screening cannot and should not replace actual appointments with a doctor for follow-up after the screening and for other health needs as well.
Experts say the HPV vaccine is another tool that's shown to be helpful to prevent cervical cancer.
That vaccine was first introduced in the U.S. in 2006. Since then, more than 135 million doses have been administered. If your son or daughter is between the ages of 9 and 12, the American Cancer Society recommends you talk to their doctor about vaccination against HPV. Still to come, most people don't know how to provide critical care for a beloved member of their household.
So we're going to start at the toes, and we're going to overlap by about 50%.
We provide insight into first aid for your pet and where you can turn to get guidance.
But first,
So I sat there and I was like, okay, is this really happening?
her disbelief became a harsh reality. We examine a recent surge of strokes in young people, explain what's behind the spike, and give you solutions to manage risk. Anyone from babies to the elderly can suffer a stroke.
And while doctors say the risk increases with age, research from the CDC finds strokes are becoming more common in people in their 20s, 30s, and 40s. Every year, about 70,000 Americans under the age of 45 have strokes, and the American Heart Association found nearly 30% of younger adults don't know the 5 most common symptoms of a stroke.
Doctors have long known that high blood pressure and high cholesterol are involved in risk, but experts say other lifestyle factors play a role in young people. Reporter Kim Clark examines the trend and what may be behind it.
Coming on in.
Loretta Plummer works in the emergency room at St. Francis Hospital in East Memphis. She's been a nurse for 8 years.
What is it about being a nurse that you love so much?
I love being a nurse just to have compassion for people, especially as an emergency room nurse. People come in on their worst days.
One of her worst days came about 5 years ago, 6 months after her son was born. Loretta was getting ready for work when she realized something was very wrong.
And then I realized my entire left side went down. I had the facial drooping, I had my slurred speech. So I sat there and I was like, okay, is this really happening?
Loretta knew she was having a stroke. She immediately called 911. Paramedics came and took her to the hospital.
I was in my mid-30s and, you never think about having a stroke or anything really that traumatic happen to you, especially if you're living healthy.
Loretta is part of a closely watched growing trend. Data compiled by the Centers for Disease Control and Prevention shows a nearly 15% rise over a 10-year period in the number of people between 18 and 44 who've suffered strokes.
Everyone always thinks like, oh, my grandmother had it, or my grandfather had it, my great-grandma had it. But now it is starting to kind of trickle down into these younger patients.
What's behind the trend? Physicians say unhealthy lifestyle choices, genetic conditions, stress, drug use, and infrequent visits to the doctor. Becky Mitchell is Loretta's boss and director of the St. Francis Emergency Department.
A lot of times there's a delay in care because they may wake up at home and think, this is going to go away, rather than, having that knowledge and education to know that these are signs that you immediately need to seek treatment for. Call 911.
Early recognition and treatment can significantly improve your chances of recovering from a stroke.
Time is brain tissue, so in a stroke, it's very important that you seek help immediately.
As Loretta knows, with early treatment, there is life after stroke. Even if you're in the prime of your life, she's living proof.
I actually had a patient not too long ago who was my age when I had my stroke, and she couldn't believe it was happening to her. I was able to actually talk intimately with her and say, hey, I've been where you are.
Loretta had all the signs of a stroke, and fortunately a call to 911 led to a quick response.
Her success story exemplifies why doctors want everyone to remember the acronym B FAST. B stands for balance and eyes, because stroke sometimes impairs a person's gait or vision. FAST is for face, arm, speech, and time. Facial droop, arm weakness, and slurred speech are signs that it's time to call 911.
To prevent stroke, doctors say focus on managing risk factors through healthy lifestyle choices and regular medical checkups.
Still ahead.
All right, if we come in and make a visit?
Frankie, boy, you behaving yourself?
He is.
We go to work with the pups of Paw Patrol and show how they inspire moments of comfort and joy for elderly veterans.
But first, preparing for the unexpected. Injuries or illness with a pet can be frightening for both you and your companion. We explore some of the most common pet emergencies and where you can turn to find solutions.
From chewing the furniture to maybe eating something they shouldn't have if you own a pet, you know that companionship can come with unwelcome surprises. As I was reading that, I was thinking Maple, Zurich, our dog, is perfect, but my wife, it drives her crazy. She does tear up one carpet, and she's saying we need to buy a new one.
They do those things sometimes.
They do.
Despite our best efforts to keep them safe, accidents can still happen, but basic first aid could help save your pet's life. Reporter Io Elise introduces us to a veterinarian providing pet owners with solutions to be prepared during an emergency.
I really love when people take this class and seeing their reactions during the class of, I'm just really excited to learn more. I'm excited to know that I shouldn't panic anytime something happens with my pet. So we're going to start at the toes, and we're going to overlap by about 50%.
Dr. Sarah Tauber is a veterinarian with Dove Lewis who, in addition to her hospital duties, teaches a pet first aid class. The class goes over a variety of topics like when to take your pet to the vet, how to bandage them up if needed, and what you should do in the most common pet emergencies.
I'd say the most common thing that we see are the GI cases, the vomiting and the diarrhea. One of the first things that I recommend is to do just a short little fasting. So no food, no water for a short period of time. Now, this is a general recommendation for most healthy animals.
If that fasting doesn't work well for your generally healthy pet, it may be time to see the vet. Here's another common case.
Toxins and abnormal ingestions, and that might be foreign bodies, like my dog ate a sock or my dog ate a toy. The best recommendation is just get to either your clinic or an emergency clinic as fast as possible.
You are much more tolerant than most of the pets out there, huh? Yes.
You may have heard of giving your pet hydrogen peroxide if they ate something they shouldn't have, but Dr. Tauber says that's a bad idea. It can cause even more problems in the long run. Depending on the item, calling the ASPCA poison control line can be a great way to get help. While intervention is important, there is something you should keep in mind.
It's a small amount of cases that owners could have intervened and made a giant difference before getting into the hospital setting. However, when we're looking at animals that are in the field training, working dogs or search and rescue dogs, or if you're out on a hiking trail 5 miles down and now you have to hike out, it's in those scenarios that it's extra important for you to have some of that first aid training.
It's called pre-hospital care, and Dr. Tauber says it should always be followed up with an appointment.
I also love teaching. I love giving the tools and the skills to people to do a little bit more, know a little bit more, so then we can work together to make their pet feel better.
All across the country, firefighters undergo training to perform first aid on house pets. This is video of the Clark County, Nevada Fire Department jumping into action to save a cat named Puka. Firefighters gave the beloved pet chest compressions and oxygen after rescuing him from a house fire. They say fire engines are equipped with oxygen masks and CPR-trained crews are on board to help animals no matter size or breed.
A German Shepherd or a Husky, larger animals like that, we'll have them on their side when we do CPR. Smaller dogs like Chihuahuas and Pekingese, we're going to do like an infant. We would do CPR with hands wrapped around.
The American Red Cross offers cat and dog first aid online training. The 35-minute course costs $25. You can go to redcross.org to find out more information.
From urgent care to TLC.
When we get in the car and as soon as the flag bandanas come out, they know they're going to be doing visits because that's the only time they wear them.
Up next, we go on the Paw Patrol with 3 perfectly imperfect pups.
And how's my little girl?
And show how they inspire joy to those they visit.
Nearly half of all veterans are now 65 and older, and these heroes are more likely to experience chronic medical conditions, mental health issues, and social isolation.
A nonprofit called Heroes Bridge in Virginia helps many elderly veterans enjoy a better quality of life. Reporter Deborah Alfarone shows us how 3 imperfect pups thank them for their service.
Sorry if we come in and make a visit?
Frankie boy, you behaving yourself?
He is.
If you want to make an elderly person smile, just visit.
And how's my little girl?
If you want to make them light up with joy, bring Frank, Rosa, and Lily with you.
That's a good dog.
There's just this unconditional love and warmth that dogs provide you, that no matter what, you know that they're always there.
Meet Carolyn and JD, the couple volunteers for Heroes Bridge, a nonprofit dedicated to helping elderly veterans. They bring their 3 service dogs to visit assisted living facilities and rehabilitation centers in Virginia. The program is called Paw Patrol.
So it's always nice to have company.
First stop, a visit with Larry. He served in the Korean War. He and his late wife used to own dogs.
My wife and I were together for more than 60 years. And so it's tough to let her go.
A lot of these veterans, they used to have dogs, and it brings them, joy to see and remember.
These veterans face different battles now, from medical to social isolation.
Good dog.
These pups have struggles too. Rosa's 2 front legs were broken, the right one catastrophically.
Rosa doesn't know any different. She just runs and plays and loves people.
Lily was rescued from a hoarding situation.
She's missing her 2 back paws.
And Frank is a medically retired bomb-sniffing dog.
He had wounds to his back right leg and his tail that required an amputation of both.
Carolyn is a veterinarian and JD a veteran. Next stop, a visit with Helga.
I can't forget you. Or you baby.
When we get in the car and as soon as the flag bandanas come out, they know they're going to be doing visits because that's the only time they wear them. And they just get so excited, and they know where we turn to go to the facilities, and they just start jumping around.
What's the best part of seeing these dogs interact with the veterans?
How each dog seems to read each veteran. There's not a lot of speech that goes around it, but you can see how the veteran is opening up to the dog. Just those few moments of joy that it brings them, I think brings us immense joy.
People that are in these facilities may not have a lot of moments of joy. And if we can bring them 1, at least, or 3, at that time, then that's all that matters.
They're moments of joy that some studies say last way past the cuddles, kisses, and tail wags.
And that's it for us on Investigate TV Plus. I'm Lee Zurich.
And I'm T. Chappelle. Thanks for watching. On the next Investigate TV Plus, a Georgia novelist finds herself living in a real-life nightmare.
You never think someone's going to actually come in and not just rob you of the things inside your home, but try to steal your actual home.
How a loophole made it easy to forge paperwork about her property and new safeguards to help crack down on these cases.